Hemolytic anemia is a disorder in which red blood cells are destroyed faster than which they are made. This is called hemolysis. Anemia results when bone marrow production can no longer compensate for the shortened red blood cell survival. The two main types of hemolytic anemia are inherited and acquired anemia. Examples of acquired disorders resulting in hemolytic anemia are immunologic abnormalities. In these cases, the immune system makes antibodies that attack and destroy the red blood cells. There's another type that's called traumatic hemolytic anemia, and it is caused by trauma. We have one type that is caused by toxins or drugs, in which they destroy the red blood cells, or an overactive spleen. Inherited hemolytic anemia means that the parents pass the gene for the condition on to their children. Two common causes of this type of anemia are sickle cell anemia and thalassemia. These conditions produce red blood cells that don't live as long as normal red blood cells. Symptoms of hemolytic anemia may vary from person to person. This is because there are so many different causes of it. Symptoms include weakness, paleness or jaundice, dark-colored urine, fever, heart murmur, and in some cases, inability to do physical activity. Now we will explain the pathophysiology behind this disease. Premature destruction of erythrocytes occurs intravascularly or extravascularly. Intravascular hemolysis is a destruction of red blood cells in the circulation with a release of cell contents into the plasma. The more common extravascular hemolysis is the removal and destruction of red blood cells with membrane alterations by the macrophages of the spleen and the liver. Hemolysis may also be intramedullary, when fragile red blood cell precursors are destroyed in the bone marrow prior to release into the circulation. As a compensatory mechanism, hemolysis will stimulate the kidneys to produce EPO, which then again stimulates erythropoiesis, which is the formation of red blood cells in bone marrow. So what happens? In conditions where the rate of RBC breakdown is increased, the body initially compensates by producing more red blood cells. However, breakdown of red blood cells can exceed the rate that the body can make red blood cells, and so anemia can develop. Treatment of hemolytic anemia includes erythropoietin therapy in order to accelerate the production of red blood cells. It is most common first to reduce the need of transfusion. Blood transfusions, but this is only when absolutely necessary. Corticosteroids, which have an anti-inflammatory effect and causes varied metabolic effects. And in some cases, iron therapy is needed when the patient has iron deficiency caused by intravascular hemolysis.